Welcome. Welcome to Rise and Thrive, the EHE Health, our new interactive weekly series featuring expert advice and conversations about all things health. My name is Lisa Mindell, and I'm a National Account Manager here at EHE Health. Today, we'll be discussing how EHE Health is reopening safely for our patients. If you have any questions, please put them in the comment section, and we'll do our best to answer as many as possible. Today with me, I have Mike Zolenberg, our VP of Network Operations, and Dr. Pensa Benne, our Medical Director. Michael, if you could please introduce yourself.
Sure, thanks, Lisa. Hi, everybody. It's really nice to be here with all of you. My name is Mike Sandberg. I'm the Chief Clinical Operating Officer here at EHE Health. I lead our nationwide preventive healthcare network. Our networks and network partners are really devoted to empowering people to lead long and productive lives through prevention and engagement in health population. We have locations in over 40 states, include our 7 EHE clinics located in New York City, Boston, Chicago, Northern Virginia, Morristown, New Jersey, Stamford, Connecticut, and Houston, Texas.
Okay. Dr. Pensa Benne, if you could please introduce yourself.
Thank you, Lisa. Good afternoon, Facebook Live community. My name is Dr. Pensa Benne. I am a board-certified physician in both internal and lifestyle medicine, and I have been a part of EHE Health since 2015. As VP Medical Director at EHE, my role is to oversee all things quality assurance, and that includes the health and safety of our employees, responsibility for the design of our evidence-based program, and for working with Mike to operationalize the reopening of our clinics and preventive program in a safe and efficient manner.
Great, thank you both. For our first question, this first one is for you, Mike. How is EHE Health creating a safe environment for our patients to come in?
Lisa, great question. EHE's created a safe environment for all of our patients and staff by developing what we're calling a Safe at Work business reopening plan. That's really going to ensure a smooth and safe transition as we all return to work and back into our communities. Our approach is founded in evidence-based research. We use public health strategies, epidemiological principles that really lead the industry with best practices for our clients and our patient populations. As we work to reopen all of our clinics, we developed a kind of a step-by-step process to do that. So prior to reopening our clinics, each of the locations were, first of all and foremost, thoroughly cleaned and sanitized by our outside cleaning vendors. Every one of our EHE employees in our clinics participated in our Safe at Work program. That included a COVID-19 antibody test, exposure questionnaire about potential exposures, and a return to work health exam. Moving forward, all of our EHE associates that work in the clinics will have daily temperature and symptom checks. They'll update their exposure history prior to beginning every shift, and they will have weekly COVID-19 antibody screening tests. We're going to be maintaining social distancing and proper infection control measures in our clinics. All of our associates and patients will be asked to maintain 6 feet of distance at all times, use proper hand washing techniques in accordance with CDC guidelines while they're in our clinics. Our waiting rooms are going to be, then the seating is going to be reconfigured to ensure a distance of 6 feet. Any seating that's not compliant, if we can't get them to kind of fit in there, we're going to remove them completely and keep that safe. Other non-essential items, you think about like magazines and other items, they're going to be removed from our waiting areas and taken out of the clinics. Our EHE associates will follow mandatory hand washing practices. You've all heard the 20 seconds, soap and water. We'll be singing happy birthday or using hand sanitizer. Hand sanitizer is going to be easily accessible throughout our clinics for both our associates and our visitors. So they'll be at our main entrance and throughout all of around our clinics. And of course, all staff will be wearing the appropriate personal protective equipment. For our patients as part of this process, and they'll all be made aware of this ahead of time, but upon their arrival, all patients, when they get to our clinics, are going to have their temperature checked. They're going to be asked to sanitize their hands, and they're all going to be provided a mask by EHE, and they'll complete the exposure questionnaire if they've not already done so in advance. They will then be escorted by one of our designated team members to a designated screening room for a COVID-19 screening test. Patients will not be permitted anywhere in our clinics other than these designated safe areas until after they've had their COVID-19 screening test and it reveals a negative result. These designated screening rooms will have specific equipment, designated staff, and really secured away from the rest of our clinics. Once that screening test is negative, patients can then proceed into the clinic, locker room, where's the next stop, and begin their EHE exam. We really feel that this is going to create as safe an environment as possible for everybody.
Yes, you outlined a lot of detail. That was great. And just to clarify, what we're implementing at the EHE clinic is the same protocols as we're doing in the network.
Yes, absolutely. So EHE Health is requiring all of our network partners to follow the same reopening procedures. We're requiring all of our network practices to certify that all their employees seeing EHE patients are appropriately screened, and all of those locations are meeting our EHE reopening criteria.
Amazing. And when do you expect that we'll have all EHE clinics and network locations open again?
Great question. All of our EHE clinics reopen this week, so we're so happy for that and happy to be starting to see patients again. So that's excellent. We are gradually reopening our network across the country. So I would say as of the week of June 8th, right now we have targeted about 50% of our national network will be open. That can change and grow moving forward every day. We're working with all of our network practices on those requirements. But otherwise, we expect the rest of the network to open soon as they meet our reopening standards.
That's great. Those are all the questions I have on the network right now. I'm going to move on to questions for Dr. Pensa Benne. So as Mike Zollenberg pointed out, there is going to be a COVID test. Which COVID test is EHE using, and does it include the antibody for everyone?
Again, another great question, Lisa. And before we get into which test EHE Health is using, I thought we could take a minute to break down the two different types of COVID-19 tests that we've been hearing about and reading about in the media and all over the news over these past few weeks.
That would be great.
So the main test that we've been hearing about, the one that has been limited, that there was a paucity of testing in the initial phases of the COVID-19 pandemic, the one that was being reserved really for sickest of sick patients in the hospital, is now more available, but still a diagnostic test. And that is the RT-PCR or PCR testing. The point of this test really is to use a nasopharyngeal swab, a nasal swab, saliva, some type of body specimen to test a symptomatic person, somebody who has some symptoms of COVID-19, fever, cough, loss of smell, or somebody who has been exposed to another with COVID-19 on a close contact. That test will be used, the PCR test, to confirm the presence of the virus and confirm an acute infection in these patients. As Mike mentioned, at EHE, we are undergoing enhanced screening protocols to really make sure that our patients and visitors who are coming in for their preventive exams have a safe environment, one that is free from anybody who has symptoms or, may need one of those diagnostic testing. These patients have passed screening questionnaires ensuring that they are symptom-free, have had no exposure, and have not had a recent positive diagnostic COVID test. So to perform that diagnostic test at our clinics, where it takes a few days to get the results back, really doesn't make much sense because we are using the COVID testing as a screening approach. And by screening, that really means that we want to look at asymptomatic individuals, people who don't have any signs, symptoms, exposure, no fever, nothing that we would suspect that they could have COVID, and use the antibody screening test to identify two different types of antibodies. One is IgM and one is IgG. And this gets a little bit complicated, but for the most part, the media, what we've been seeing from the CDC, the recommendations about antibody testing have been specifically related to the IgG antibody. And the reason is because people really hope that those of us who are found to have an IgG antibody may have some sort of immunity to COVID-19. You know, the evidence isn't showing that yet. And all we at EHE Health would say to somebody who has an IgG antibody is, looks like you had COVID-19, but you don't currently have it. We're actually going to be using this antibody test, the one that has IgM and IgG, at a point of care. So in our clinics with real-time results. And the purpose of this, again, is to screen for that other antibody, the IgM antibody, that we do hear less about in the media, but still plays a very significant role in COVID-19 pathology. And the IgM antibody, if found in a person who doesn't have any symptoms, could imply that this person is an asymptomatic carrier or a silent carrier of COVID-19, that they may have the infection and just not show any signs and not know it. And our goal with offering the COVID-19 screening test, before the preventive exams and on all of our employees, is to really identify people who might have that IgM antibody and say, hey, listen, I know you feel well, but we're going to recommend you go home and you self-isolate and you follow up to get a diagnostic PCR confirmatory test to know whether or not for sure you do have a COVID infection and not know it. If they do, we will provide clinical guidance and recommendations about how long they should stay at home and when they will no longer be infectious. But really, it's that IgM screening on the point of care antibody, that test that we are using at our EHE Health Clinic to make sure our preventive health exams and experiences are as safe as possible.
Great. What happens if someone has a temperature or tests positive for COVID?
So we do want to remind our members that we can have a temperature or a fever for many different reasons. Not all fevers equal COVID-19. But we do want to have the safest environment. Again, we only really treat well patients for their preventive exams. And anybody that's found to have a fever or found to have that IgM positive COVID-19 test will be told that they could be infected. They will be provided with clinical discharge instructions that will recommend the next steps. Of course, stressing that this was just a screening and recommending follow-up confirmatory PCR testing and or follow-up discussions with their primary care physician to really understand what the right steps for them regarding self-isolation and testing. And also when they can come back and give us a call and reschedule their preventive exam.
What would you say to a patient who might skip their EHE Health exam this year due to fear of contracting COVID-19?
I would say it's unfortunate. We have worked really, really hard to design these enhanced safety protocols to use all of the available evidence, to ensure that the environments we are offering and the preventive exams are really as safe as any other place could be. So I would say that I understand that we all want to really kind of live in a bubble, and try to be as safe as possible and avoid any potential exposure to COVID-19, but that is not going to be possible. This is a new normal we are re-entering, and we are going to have to continue to take enhanced precautions. And why not have your first step be at EHE Health, where we really have put these measures in place to make sure that we are the safest place you can come visit and get your EHE Health exam and understand where you are in your preventive health.
Understood. If someone's on the fence and they're thinking, I'm already wearing a mask, I'm social distancing, is this really necessary? What are your thoughts on that? If I'm already being preventive, do I really need a preventative exam?
I think that's a great point. And, and it's my job to point out that preventive health and preventive and lifestyle medicine do include personal infection prevention and public health preventive guidance and protocols. And we are absolutely the preventive health experts, but it goes much further and deeper than that. So a preventive health exam like the ones we offer at EHE Health are designed to identify asymptomatic infections just like COVID-19, screening for sexually transmitted diseases, to provide routine vaccinations, and to screen for underlying risk factors and medical conditions that could, if not identified and treated, really increase somebody's risk of developing severe and, fatal COVID-19. So preventive healthcare screenings like the ones that you can get at EHE Health really are much more than infection prevention and are life-saving.
I feel like you just touched on this, but it borders on my next question, which is, how does an EHE exam help lower someone's risk for a more severe case of COVID-19?
Did touch on it, but we can get into it a little bit more. And thank you for asking this question, Lisa. So COVID-19 has taught us a lot of things. It has taught us to really try to be prepared as possible, to expect the unexpected, and to know your own risk profile, to understand where you are on that health spectrum. COVID-19 has been identified to affect specific types of individuals, those with uncontrolled chronic diseases, high blood pressure, severe obesity, diabetes, things that we look for every single day at EHE Health, and it's not having these conditions. So it's not just having high blood pressure that puts you at risk. It's having it, not knowing it, having it and making bad lifestyle choices that continue to make it worse. So our job at EHE Health is to identify your underlying risks, to have those conversations with you, the shared decision-making process about where you are. You could be obese and hypertensive and have diabetes. You could be young and healthy and have none of these medical conditions, but be an asthmatic or a cigarette smoker, and really understand your own risk profile so you can work with us, our health mentors and our EHE clinical team, to make those lifestyle changes now, because the future is really uncertain with the pandemic, and the time is now to make your lifestyle changes and get out there, and exercise and do it safely.
Yes. It's great that we're offering the COVID-19 testing, but if someone already took a test and they know what their status is it still worth coming in for a full exam?
Absolutely. Absolutely. I'd say kudos on, knowing your status and understanding kind of your own history with COVID-19, whether you had the infection, you didn't have the infection, you have evidence of having had the infection. It is good to really understand how it affected you personally. But again, we don't know what the IgG antibody really means, what having had the infection means. If there is any sort of protection, it is not a long-term immunity. So it does seem like there's potential for either reinfection or repeats exposures. So knowing your status is great, but it doesn't mean your status will stay the same. The other thing is, we're going to double check. No test is 100% perfect. The diagnostic testing comes with some false negatives due to the way we have to get the specimen. The antibody test, as we see the IgG, has slightly lower than 100% sensitivity, which in some parts of the population could lead to a false positive. So putting as much information as you have together and also getting that point of care antibody test result from EHE Health is important. But again, the message really that I want to get across today, what's more important is taking back control of your life, of your preventive health, getting back 2020, knowing where you are in your health status, and really working with us to make those changes that we all need to make.
Definitely. Thank you so much. Those were all the questions I had. So now I'm going to go look in the chat box to see what our audience has to ask. Okay, already got a couple great questions. The first one is, will there be an appropriate signage so patients know how to keep 6 feet apart in the waiting room?
I'll take that one. Thanks, Lee. All around the office, from the minute you walk in to our reception areas, to in our waiting areas, to between the in the clinic spaces and the offices, well put around the office.
Great. What should we do if an employee or a coworker begins to show symptoms after returning?
It would be the same guidance that we're providing somebody who is IgM positive. We have prepared discharge instructions, have a COVID-19 hotline staffed with clinical teams that can speak to them about their symptoms, but we would advise them to wear their personal protective equipment and to go home and self-isolate and undergo diagnostic testing if they are displaying COVID-19 symptoms, while also letting their manager or HR team know.
Great. There was an article on CNN about the accuracy of antibody tests being only about 50% accurate. Is this true?
So that is what I was touching on with the sensitivity and the IgG antibody and the recent CDC and statements regarding this. So it is true that sensitivity that is not 100% in different areas of the country where there's low prevalence of the disease or low density of people who have the disease, that a slight decrease in that sensitivity of the IgG antibody test can lead to false positives and be inaccurate. And, you know, I think the harm of false positives with an IgG antibody are this false sense of security and this false sense of immunity. And maybe the thought that you can't get it again, or that you're not going to be as safe as the rest of us. I also know there's concern about some employers' approach to maybe using that IgG antibody to select who can go back to work and who can't. And that really wouldn't be the recommended approach here at EHE. It's not what we're looking for. And again, until we know more about what IgG means, you know, it is true that you can have reduced accuracy of, you know, as up to 50% where there's low prevalence. But the IgM antibody, on the other hand, if we get false positives on our screening test, it's okay, because we are making those follow-up recommendations. We are saying this is just a screening test. This is for the safety of everybody and enhanced precaution. And we're going to recommend you get that follow-up confirmatory diagnostic test that will tell us one way or the other if that IgM antibody was a true positive or perhaps a false positive, although unlikely.
Great. Now that we established that everyone should feel great about coming in for their exam, I got a question saying, I'm nervous about taking public transportation to work, to appointments. I need advice on how to travel safely. Yes, thank you. And this is, you know, top of mind for all of us that take public transportation to commute into work. And it is something that we are going to need to continue to make those enhanced precautions and preventive measures. And that the CDC did just recently release guidance on how to take public transportation safely, wearing your face masks, keeping social distancing on the platform, social distancing in the terminals, as well as the enhanced cleaning protocols that the public transportation authorities are undertaking. Along with this, we have done some research on influenza-like illnesses and have spoken with some experts who have kind of researched
what percentage of these types of viruses are transmitted on public transportation. And it is pretty low, less than 5% of these viral infections are transmitted in these types of environments. And there's a few reasons for that, but the main one is, although yes, we might be in tighter quarters, we are wearing our face masks, and we're not on the public transportation in those close contact environments for prolonged periods of time, like we may be, in a small classroom or a conference room. So really enhanced precaution on our end, enhanced precaution on the public transportation authorities end, guidance from the CDC, and the evidence we have available really would guide me to tell you that it's okay. We have to travel safely. Again, this is a new normal, and we have to kind of use the evidence that we have and protect ourselves. So I myself will take the train. I will follow all of these precautions, and I will know my risk, as well as, closely watching for any symptoms should something change.
So really the takeaway here is we have to be cautious, we have to be safe, but really getting your exam is of the utmost importance right now, given everything.
We need our preventive vaccines. We need to be screened for those underlying conditions that can increase our risk of dying from COVID. We need to start to take action while the weather is good, while we have some time to make those lifestyle measures. Prevention is more important now than ever. I hope Dr. Levy, our CEO, won't mind if I borrow his catchphrase, and it's been COVID compresses time, and time is of the essence. So really now is the time to focus on prevention, to focus on self-care, and make lifestyle measures and improve your overall health.
Thank you both so much. I really appreciate all of your feedback and joining. Anything you two want to say as we close out?
No, thanks, Lisa. Thanks for moderating here. Appreciate it.
Thank you very much. And for all those listening, remember to follow us on Facebook, LinkedIn, and Instagram for additional content. Tune in next week at 1 p.m. and we're going to have a high cardio dance workout. Thank you all. Have a great day.
Thank you.
Bye.
Bye.